Hi everyone. So thank you for watching. This is Lexi Montgomery with Darling Web Design, Darling Miami, and we have Dr. Pamela Mehta here. She's with Resilience Orthopedics in San Jose, California. And so, Dr. Mehta, could you introduce yourself and tell us more about you and what do you do exactly?
Yeah, hi. Thank you so much for having me on today. My name is Pamela Mehta. I'm a orthopedic surgeon here in San Jose, California. I went to school at USC, Go Trojans, in Los Angeles for college and medical school, and then I did my orthopedic surgical residency in at Columbia in New York City. That's a 5-year program, and then I came back to California. I worked for a large group, and I found it actually quite difficult once I had my children. So after several years of that, I left and I started and run my own private practice now. I'm an orthopedic surgeon, which means that I take care of most musculoskeletal issues, including the shoulder, knee, hip, hand, foot, and ankle. I treat patients non-operatively if they need, and if they need surgery, then I do surgery as well.
Wow. Okay. So how did you get into orthopedics?
That's a great question. I had no idea I wanted to be a surgeon. I was in medical school thinking I wanted to be a primary care physician. And so I actually put all my surgical rotations kind of at the front end of my schooling. And as soon as I did my trauma surgery rotation, I just fell in love with surgery. I loved the adrenaline. I felt like it was a very efficient field where we're fixing people. I liked dealing with one specific problem and being able to help a patient that way. And so as soon as I figured out I wanted to do surgery, then I started exploring all the surgical fields. And I really enjoyed orthopedic surgery because for the most part, patients are healthy. They want to get back to their lifestyle. They have one injury or one joint or one limb that's causing them pain, and we can fix that for them and get them back to their active lifestyle.
And so, would you say that's the best part about working in your industry?
Yes, I love my industry for a lot of reasons, but one of them, yes, is that we are able to help patients kind of with that one particular problem, and then for the most part, get them back to their life. Orthopedics is truly an innovative field. Also, we have a lot of kind of new implants and hardware out, and also we're really kind of at the forefront of regenerative medicine, stem cells, PRP, things to preserve joints and not just replace them. And so I think those are kind of the exciting things in our field. Also, a lot of my procedures and surgeries vary from big open surgery, joint replacements, fracture work, to small arthroscopic surgery. And I really enjoy that as well.
Wow. Okay, what would you say is the worst part about working in orthopedics?
Well, it's a heavily male dominated field. In residency training, I think the latest numbers are that 14% of residents are female. And then when you get out into private practice, that number is even lower. It's about 5%. And so I sometimes miss having colleagues that are females, and just having that camaraderie and collegiality. And I think especially when you're a mom, you kind of want a little bit of that. So I do miss that aspect. But in terms of the actual field, I love it.
Wow. And so, which age demographic would you say is the hardest to connect with?
Um, hmm. So I treat patients from young kids from when they're 2, 3, 4 years old and they have fractures to an older population that's dealing with arthritis, and they just really want to get back to being able to take their morning walk or play with their grandchildren. And so I feel that I usually connect with most age groups, kind of trying to see things from their point of view. I have that middle kind of younger adult middle age population that are really active in sports and are just trying to get back at the level that they see themselves at. Probably it's hardest to relate to the patient that is kind of entering their middle age,
Okay.
and they're seeing their body fail them, and they're not really sure why. So the patient comes in and says, I play basketball on the weekends now. I'm in my 40s or 50s, and I have these aches and pains. And it's kind of difficult to explain to patients that, we don't all have this deal with God, and our bodies are sometimes going to fail us, and we don't always have the perfect treatment or surgery for that.
Okay. And why do you think it's hard to kind of communicate that to that age group?
Well, people don't want to hear that there's not a solution for their problem. So I think, the easiest patients are those that come in with some kind of imaging or symptom that's very clear cut. They have knee pain, they twisted it, they tore a ligament or a piece of cartilage, and we can fix that. The patient that's more difficult is I'm running, 6 miles, and at mile 4, this specific spot on my knee starts to hurt, and all the imaging studies are completely negative. So those patients are a little bit harder to communicate to that, maybe we're not going to have the best options for you.
Okay. Wow. Yeah. That makes sense. So Dan Kennedy, a strategic marketing coach, says that businesses only struggle with 4 things, and it's pretty much money, time, people, and passion. So what would you say is the most common struggle in orthopedics?
I think in medicine in general, and probably maybe more so in the surgical fields, I think it's probably money and time, because now with the insurance companies, they've made things really difficult and really have come between the patient and the doctor relationship. And so we are hard pressed to see more patients in less time for less money. And I only bring up money because we also have to run a business where we're hiring employees, we're renting space, we have supplies. Right. So we have to at least be able to cover those costs. And so I think that in medicine and, in general, and probably surgery a little bit more, I think we're pressured to really see a lot more patients in a certain amount of time. Now, I have circumvented some of those problems in my private practice because I did practice outside of a larger group. I have been practicing outside of a larger group for the last 2 years. And so I've really built my practice kind of to be exactly what I want it to be in terms of being able to spend a lot of time with my patients and seeing specific problems. And I really kind of feel like I'm able to do that because I'm my own boss and I'm the business owner, and we run very lean in terms of the amount of employees and other staff that we have here.
That makes sense. Makes sense. So aside from business, how would you say your family and friends would describe you outside of work?
I think that they would describe me as extremely passionate about my family and my friends. I really try when I'm home to disconnect and spend a lot of time with my kids and my husband and my friends. We're probably never home. We're outdoors all the time, whether that's the boys learning how to ride their bikes or going swimming or for a hike or exploring the Bay Area. We like to travel a lot. So I think just spending time with my family and friends and trying to pack as much in as possible during non-work hours.
So what gets you, would you say that gets you out of bed in the morning? What gets you out of bed in the morning? Like, what are you most passionate about?
I think these days what I'm really passionate about is achieving that work-life balance and really being an advocate for women in surgery and in underrepresented fields, and really feeling strongly that women can be and do anything, and they can have all things that they wish for, a career and a family. And maybe those things are not equal. And maybe, some days your career is more important, some days your family is more important, but they can have all of these things in their life. And I think right now I'm a strong proponent for getting women to see that they can do those things and that they don't have to follow a traditional path. I mean, it would have been very easy for me to stay in this large group, but I decided to leave and kind of do my own thing because I thought it was best for my family, and ultimately it became the best thing for my career as well.
Wow. So that balance, that work-life balance, that's awesome. So Okay, so what would you say then your long-term goal is? So you've achieved all this, you've done all this, you have your own practice, you have a family now. What would you say your long-term goal is?
Um, I think it goes back to that balance. I don't think I have fully achieved that yet because there are days where I'm working very hard
Mm.
at my career and my business in the hopes that at some point it will be a well operated piece of machinery. Not that it's not right now, but I have to be here a
Yeah.
lot more. And I really hope that at one point I could get to a place where I'm really coming in and just taking care of patients. I'm not so worried about the kind of back end office work of it. And that will allow me more time with my patients and taking care of people, and then also allow me more time with my family.
Yeah. Awesome. Well, thank you so much for
Yeah.
doing this quick interview with us. Where can viewers learn more about you?
Yeah, absolutely. So I am on Instagram at Dr. Mehta, and there is a link there to my website. So I share a little bit about my family, orthopedics, running a business. There's some women empowerment and women supporting women kind of thing there.
Yay.
And so you can, yeah, follow me on Instagram. And like I said, there's a link to my bio and my website. So you can find me out the orthopedic wise through that as well.
Awesome. Well, thank you so much for doing this interview with Darling, and we look forward to following your career and seeing where
Yeah.
you go.
No, thank you for having me. I really appreciate it.